Sir, shall we start, sir?
Please.
Please. So, seeking the blessings of His Holiness, it's a privilege to welcome all of you to this webinar on relooking at the role of teachers in the medical colleges beyond COVID-19. COVID-19 has brought phenomenal changes in many areas, one of which is education. More so in medical education, where the care and the teaching learning goes hand in hand, and a teacher in a medical college wears a lot of different caps, not just about patient care, but also teaching at the undergraduate and the postgraduates and the allied sciences. In this background, we wanted to look at what kind of challenges and opportunities are happening. What is the role of the psychiatrist? What is the role of organization, and what kind of research is required in medical education? So we have a list of distinguished speakers in this program, and there are a lot of awards to be notified, which has been coming from the Minds United Trust, which has been funded by the Infosys Foundation. So the first and foremost, I would like to welcome today's most honorable Padma Shri, Dr. B.N. Gangadhar, who is the President of Ethics and Regulation Board at the National Medical Council, and he was also the former director of the NIMHANS. He is incidentally also honorary advisor to Indian Psychiatry Society Faculty Training Task Force, and for many things he wears. We extend a warm welcome to you, sir. Welcome to you, sir.
He's also in the board of management of JSS Academy of Higher Education Research.
So welcome to you, sir. My next welcome is to the beloved teacher and a wonderful academician, Dr. H. Gowdappa, who is also the principal and dean of Faculty of Medicine, JSS Academy of Higher Education. He is an exceptional teacher and a clinician and an administrator, a rare combination. He is remembered and recognized by the students as one of the best teachers you can learn with. He is also a very supportive for many of the initiatives we undertake, and he has extended all support to the Department of Psychiatry, also all the endeavors we take in relation to psychiatry. Sir, a warm welcome to you.
Thank you, Kishor. Thank you, everybody.
I would like to extend my warm welcome to the Indian Psychiatry Society President, Dr. Dalal, who's there. Sir, a warm welcome to you for taking your precious time and joining this program.
Thank you, Kishor.
Our own colleague and a very senior professor of psychiatry, honorary secretary of Indian Psychiatry Society, Professor T.S. Satyanarayan Rao, who is going to be chairperson of this today's talk. Sir, a warm welcome to you.
Thank you very much.
We have with us the head of the Department of Psychiatry, Dr. Rajesh Raman, who has been supportive for all the endeavors we take, who is going to co-chair with TSS Rao for this session. A warm welcome to you, sir. We have with us Professor Mohan, who is the adjunct faculty at the Department of Psychiatry at JSS Medical College and JSS Academy of Higher Education and Research, who is also Professor of Clinical Psychiatry at University of Western Australia, who also has been adjunct faculty and visiting professor at NIMHANS and Manipal, who has been part of many programs and initiatives we take, and a very warm person and a wonderful teacher. Sir, warm welcome to you.
Thank you very much, Kishor.
I would like to extend warm welcome to Professor O.P. Singh, a wonderful individual who has been academician.
Kishor, your voice is breaking.
Is it audible, sir?
Yeah.
A very warm welcome to Professor O.P. Singh, who himself calls as a teacher who is inclined with the job of teaching at first, then the editor of Indian Journal of Psychiatry, and a person who has been partnering us on many the things we carry out. Sir, a warm welcome to you.
Thank you so much for having me here.
So we extend all the participants and the winners of this awards who will be named in a couple of minutes. With this, I now request our Honorable Principal, Dr. H. Gowdappa, to give his talk on opportunities and challenges for a teacher in the medical college. Sir.
Yeah, no, we're trying to extend. Yeah, we are going to extend.
Sir, over to you, sir. BG, sir? Hello? Hello? Hello?
I think he's logged out, Kishor. I think he's logging in again.
Okay. Is he logging in? Yeah. In the meantime, I have to extend my welcome to Professor Heenal Shah from Topiwala National Medical College, who is a co-director of the FAMER. And also, Madam, welcome to you. Dr. Vikas Menon, Adjunct Faculty, JIPMER. Welcome to you, Dr. Vikas.
Thank you, Kishor. Thank you.
And all the other people who are there, Dr. Vinay, Dr. Kiran, and all of you who are going to see this program. I think we have missed the net connection to our principal. I'll just check in a moment.
Just invite welcome. Join us. This iPad workout acting. Gangadhar introduce Mohan. Just some where did I consider begin mother end mother. ಇದು ಸರಿಯಾಗಿ ನಿಂತ್ಕೊಳ್ತಾನೆ ಇಲ್ಲ ಯಾಕ ಅಲ್ಲ ಬಿಜಿ ಏನಾಗ್ಬಿಟ್ಟಿದೆ ಅಂದ್ರೆ ಟರ್ನ್ ಆಗ್ತಾ ಇಲ್ಲ.
BG sir has said he is going to join in a couple of minutes. There's some error in the system, so he's trying to log in and think. And I request everyone to mute before we have this thing. Dr. Gowdappa, our principal, has communicated that he will try to join. We can proceed with the program. I request Professor TSS Rao and Dr. Rajesh Raman to chair the session and carry forward this proceeding. Sir, over to you.
Thank you very much, Dr. Kishor, and all the people who have organized this particular program. At the outset, personally and on behalf of Indian Psychiatric Society and Department of Psychiatry at JSS Medical College and JSS Academy of Higher Education and Research, our sincere congratulations and compliments to you and all the team members for this excellent program. Extremely important that teaching and learning is one of the part and parcel of life of a teacher. And one important point is that actually we have to keep learning, innovating, and progressing time to time. But there are some core values which have a lasting effect, and there is no escape from those things. And from that particular angle, this re-looking at the role of teachers in medical colleges is very timely. Much more because the whole of undergraduate education is going through certain modifications. Medical Council has been reformulated, and the idea that the young generation looks at it from many different angles, the teaching and learning. More than anything else, the COVID-19 has brought many different perspectives. And from that particular angle, chairing a session of Dr. BNG, what we call him lovingly, is something, an opportunity God-given, and I'm really obliged. In fact, I know Dr. BN Gangadhar for a long time, almost around 3 decades now. And the important point is actually being humble, considerate, and be a group man or a social being is actually, one can reach the pinnacle of, in fact, opportunity is something he exemplifies. He has been a good teacher, and in fact, very focused way has brought in the development of the institution. More than anything else, his work in the field of yoga and other things, pretty novel, and in fact, world over, this has been given due importance. With these few words, I request Dr. Rajesh Raman to speak a few words before Dr. BN starts off his presentation. Welcome to you, Dr. BN Gangadhar. Very nice to see you again, and we are very lucky that way.
Thank you, Doctor. Do not want to add any more. Introduce Professor BNG. Sir, please.
Okay, let me share some slides before we go on. Hopefully, I will be successful.
Okay.
I'm sorry, this is not the one which I wanted to share. Can I start, sir?
So please.
I'm audible.
Yes, you are.
You're audible, sir. Go ahead.
At the outset, let me thank the entire team, Kishor and Co, who have received great guidance from Dr. TSS Rao in organizing this, I'm sure. Also, I'm honored that Dr. TSS Rao and Dr. Rajesh Raman are chairing this session. If I have gained any expertise or any skill or any attention to be able to speak in this session, I must thank many of my teachers who made this possible in me. I have to thank Professor Mohan, who has been a teacher to me when I joined NIMHANS. We were colleagues, although as a junior colleague, I learned a lot all through my association with him. And sir, I thank you for making me what I am today in a way. And that makes me eligible to be speaking in this webinar on teachers in psychiatry. I will flag some issues which are very relevant to teachers who are teaching psychiatry. There are concerns about both PGs and UGs. Let me go one by one. Let me talk about PG teachers because that is the place where I spend a lot of my time. Most often, although things have changed in the recent years, people who come to do post-graduation, the fresh ones, really do not have any idea about psychiatry. They, of course, may be wishing to become psychiatrists, and particularly so in institutions like NIMANS or JSS, where they qualify for an entrance in the entrance examination to become PGs. But nonetheless, their grounding in psychiatry, what you would expect an average doctor to have, would be literally zero. So we are dealing with a group of people, unlike other specialties, surgery, medicine, ENT, ophthalmology, OBG, you name it, there is some attention that has been given to them. And these students also learn a lot of these things in the undergraduate studies. They know what it is, what is in store. But what is in store in psychiatry is something that they usually will not have. This is one of the concerns or issues that we probably have to prepare ourselves. And worse, some of them could still harbor some of the myths that is prevailing in general population. Hundreds of things. Although by virtue of being doctors, by virtue of working in modern hospitals, where because of the earlier MCI and today the NMC, psychiatry department is mandated, the myths would have gone. Myths would have gone. But for some reason or other, some would still harbor some of these myths. Like I recall about 3-4 years ago, one of the students telling me that one of the reasons why he joined psychiatry is that he understood. At the end of the 3 months posting, one of the feedback that he gave me was he was very pleasantly shocked to know that psychiatric treatment is made with medicines and drugs. So when he came, obviously he thought there was no medicines for psychiatric illness. So I'm sure many could still be harboring some of the myths in psychiatry. One of the common things is psychiatric conditions do not have a physical illness. This is something that I have seen very often in many of the students. Physical systems are all right in these individuals who are seeking consultation in psychiatry. And so by way of default, attention to physical conditions are also ignored, and this could well be one of the myths that we probably have to burst. Given this new area in which they're coming in, unlike other specialties where during their MBBS time they have gotten exposed, psychiatry having not been exposed, you should expect them to face stress. I do not know if there is any good research that has been done in stress levels of psychiatry residents versus non-psychiatry residents. I'm not sure, but I have seen stress as an issue way back in late 80s. I recall one of the students came back to me after almost 8-9 months in psychiatry. This person was a gold medalist and so on and so forth. He came and told me, sir, I am losing interest. I feel that this subject is burning me out. I asked him why. He said, it's totally different, sir. The way I was working in medicine, surgery and those undergraduate training was different from what is happening here. And when I asked him what it is, he said that there's nothing that we need to do, examining this patient, testing this, sending the blood report, getting the blood report results on the basis of which we change the treatment on a day-to-day basis, which will happen in medical wards. None of those things are happening here. And I think I'm a misfit to this. So I was told by some of the classmates and the residents that in the last 3-4 months, particularly, a person who had come with great enthusiasm, like I said, a gold medalist in his undergraduate course, having topped and gotten into MD course, really he started feeling that this is not my place. it's possible that some could well be facing this sort of a stress that this is not the way I wanted a medical specialty to be. And of course, the new issues such as having to manage a psychiatrically ill individual, the way other patient speaks, the emergencies, many of these things which having been new can make them feel quite distressed. And so one should expect as a teacher great levels of stress in fresh PG students. And so we have to have a different focus in our training, helping to build resilience in them. I will also come to another issue which they probably have to learn, and that will happen only by seeing other doctors. I'll come to that later. But amongst all the specialties, I believe resilience building is expected in psychiatry. A lot of times, one of the psychiatry colleagues told me that when he was feeling low, when he wanted to just share and discuss some thoughts with other classmates of his, they would all laugh it off, saying that as a psychiatrist, you ought not to have anything at all. You should be winning over all these stresses. You should be resilient. So this expectation is there, and building resilience is also an important issue which we need to pay attention. And having said this line is something that has been brewing for quite some time and has been made a little more formal in the Medical Council of India now. And we probably going to take it up more seriously in the days to come. One is emphasis has to be equally placed on both skill building and imparting knowledge. Very often students think that the knowledge is a priority because that's what is going to help them to crack entrance examinations and get a PG seat. And inadvertently, though, all the teachers also focus on building the knowledge. All medical colleges also help in knowledge acquisition so that they can be prepared to pass the entrance examinations and get postgraduate seats what they want. And so for some reason or other, skills are ignored. And this has particularly crept in the last 2 to 3 decades, 2 decades very precisely, ever since the entrance exams became very mandated. One has to crack the entrance exam before he or she gets a PG course. But since then, in the last 2 decades in particular, focus on skill building has taken a backseat. But I know that this has come to the attention of many planners, higher educationists in medical education. Very rightly, the Medical Council of India made it a skill-based education, and skill has become skill imparting becomes a very serious issue in medical teaching. And psychiatry is no exception. We have to focus on both skill building and imparting knowledge. Unlike other clinical science in physical medicine, whether it is a tendons jerk or pupillary asymmetry, demonstrating how liver is palpable or not, there are standard systemic methods which are available, and that would be quickly learned, and that is uniform across all clinicians, and they there's no issue there. But unlike that, demonstration of clinical science in psychiatry, how to elicit them, which is also an important skill. How are we going to build this? Patient to patient, it is different. And the way in which the patient builds a connection with the doctor who is treating him makes it all important for him or her to report a clinical feature which will be pathognomonic of some condition. I recall a very senior executive who had come to the OPD, and it was a unit case conference. My senior professor was there in the unit case conference. The resident had done a serious, very lengthy workup in the last almost 24 hours, spending a lot of time with the family members and so on and so forth. It took some time for him to demonstrate what all the clinical skills, and he made a good presentation in the clinical case conference. However, the senior consultant who was there asked a very important question, with which there are many other events, many other phenomena that cropped up in the way in which he started speaking about extraordinarily bizarre delusions, which we could, he said, I was coming from Mars. I have been to other planets, and since I recently went to Mercury, which is closer to Sun, I was tanned and I have gotten darker, unlike the next doctor who is there, who is fair. So many of these things which the resident and even the senior residents who had interviewed the person quite lengthily in the before the case conference were not able to elicit, but few important questions by the senior consultant made all this come out very colorful way. And this, how does one master the technique of eliciting clinical science, is another issue which we need to teach. I know for sure that each teacher would be different in this. Each teacher has his or her own skills to impart the skills of picking up eliciting clinical science. And this is something that we need to pay attention. And if there is any opportunity, we have to have a consensus, and also on a continuous education to all the teachers, that we hone our skills of how to elicit clinical science, and the training of how to elicit clinical science to the students. So this becomes very important. This is a little different from other clinical subjects, so that we need to pay attention. Emergencies are something that many senior teachers somehow avoid. Again, not by design, but being senior persons, because they are senior people, they don't have to really go to the clinical areas where emergency services are being offered, unless a special situation demands and they are called. Very often, it is managed by a senior resident and a junior resident at best. The closest training that they get is by the senior resident. Like one of the senior consultants was telling me that he learned what the current acute sedation protocol that the ER people were observing, because the senior resident who was in charge of the ER had put up a protocol, and this drug X, drug Y, drug X plus another Z to prevent side effects. So this algorithm was used by the senior resident. Of course, he or she would have discussed it with her seniors before putting it, but one-to-one training in acute situation rarely happens in psychiatry, at least by psychiatry teachers. This is some area where I found we need to pay attention and to be able to give more time in this particular emergency situation handling. Those who are working in general hospital, the first component of other special situation liaison doesn't occur. Because they are working in a general hospital, and day in and day out, they will have referrals outside of the Department of Psychiatry. And so their skills in liaisoning, the liaison psychiatry in particular, would be fairly good. However, very often, the liaison work is usually managed by a resident and a senior resident. Consultants are teachers who reach out to liaison situation, sit with the student, sit with the PG, sit with the patient, and do the liaison management. The liaison psychiatry in particular has not been very common. I'm sure many of you may want to respond to this, but I know it is. most of us have been trained in specialist centers. There is whether it may be NIMANS or any other PG institution. So much so that exposure to primary care psychiatry, that you have to work in a community and that you have to see patients there, and the way they present could not have been described in textbooks. And there are other challenges working in primary care. The way in which other people at the primary care level look at the psychiatrist, and it's another challenge. And in a primary care situation, the psychiatrist also has to be leader. Quite a number. I remember Dr. Srinivas Murthy and Dr. Mohan keep telling that work in community mental health is actually a good leadership by an academic or professional person. Demonstrating this leadership in the community is something that becomes very important in primary care management. And of course, there are a host of other issues which are important in primary care. I'm not going into those things. This is something that we may not teach the PG or prepare him or her to be equipped for this, to be equipped for the skills required for primary care psychiatry. Last year, we saw the disaster of COVID, a national pandemic. It's a pandemic. At a national level, we established helplines, and people be able to talk to them, and etc. In a disaster situation, mental health services become very important, and how many of the teachers hold hands with the psychiatry PGs who are training and reach out to the situation is some introspection that all of us have to do. And it is very important that the special areas, of course, I have not indicated many other specialty areas, which I know in other institutions don't run as separate department. For example, child and adolescent psychiatry, addiction psychiatry, geriatric psychiatry. These are all embedded in the overall psychiatry training itself. So no special situations are required. However, disaster management training has been recognized as very important, and that we have found it very useful in the last year. And how do our teachers be prepared to manage such situations and impact? In the second and perhaps the last slide, teaching psychiatry, there are skills required for the teacher. Most of the time, that the skill is a passive building of our repertoire, and we go on to teach. But is there a structured way in which teachers' skills are enhanced? It's something that I have not seen very often, but I guess that this should happen. Particularly when you are talking of undergraduate training, JSS, you have undergraduate students, NIMANS does not have it. So training undergraduates needs a special skill, we training postgraduates. In undergraduate, you have to do a little different work because all of them will not be able to see every psychiatric patient. And very often when psychiatric patients are being seen, I have heard that the PG teachers keep the undergraduate students away for reasons which they know it best. I don't know. So undergraduates never get a chance to see clinical science in psychiatric patients, but this is some area that we need to use, not so much that they need to acquire those skills. If they acquire it is good enough, but that psychiatry is a medical profession which involves the same training that is required for other specialty degrees. So psychiatry has to be demystified in the eyes of the undergraduate students. And more importantly, a good amount of knowledge at the undergraduate level is also going to be helpful. And some exposure to various public health work that undergraduate student who, when he eventually or she eventually passes out the MBBS course, what are the skills specifically required to manage public health scenario in the mental health field? This is some a special area which we need to focus and impart. PG teaching is even different because PG teachers are going to be what you are today. PG students are going to be what you are and me are today. And so they have an opportunity to elevate themselves to this level over the course of their postgraduate clinical practice. So PG training need to focus on several areas, which I'll be coming to a little later. So undergraduate and PG training are going to be different. Skills are different in teachers. Many teachers also are called upon to build skills in special groups. One example is GPs. There could be situations where the teachers may also want to work in the public health community area, wherein training of health workers, training of ASHA workers, and training of many other specialty areas like law officers, the police officers, the public in general, the employees, the employers, the other special areas where counseling becomes important. The counselors, the lay counselor, or counselors who have come without any formal professional education. So there are a wide spectrum of special groups which we probably have to equip ourselves to be able to teach them. I recall myself very well. I recall an episode about myself very well. I was asked to do a training program on differences between psychosis and neurosis. I'm talking of these thoughts way back in late 80s to a group of medical officers who had come for some training in community psychiatry. It was the turn of another colleague of mine. Unfortunately, he was not available on the day. And my senior colleague told me that you do this class for these people. After all, you're a psychiatrist, you should be able to teach. That is the time I realized that these are the areas where we are again not prepared. An average psychiatrist is not prepared. And it becomes very important that if we have to operate as leaders, these skills become very, very useful. In undergraduate, we teach in a classroom, a lecture, and we go off. We may also teach a postgraduate psychiatry, various ways in which we teach. It could be seminars, it could be journal clubs, guest conferences, and so on and so forth. But I think every teacher should teach a student. Teaching psychiatry, yes, of course, is important, but teaching a student is important because each student is a different person. Each student who learns, it is not a standard theoretical education, but it is some skills that he probably have to develop better than maybe establishing rapport. Being confident when talking to or listening to the patient, being compassionate to the concerns of the individual. So there are a wide spectrum of talents and skills which could be imbibed in the personality of the individual for some reason or other. And we probably have to, as teachers, pull them out for some more and for some less. So each student is a different student. Each student is an individual student. So while teaching, I have seen that happening in demands. Many of the teachers know what are the strengths of this student and what are those weaknesses, and then they appropriately tailor teaching to a given student. And of course, in the process, they are creating a specialist from a person who would have come very raw without any other background or without any skill. So this creating a specialist out of nothing, particularly in mental health, is a serious challenge. And one of the things that I keep talking about to my junior colleagues who are now teachers is that you are teaching each student, you are making each student to becoming a specialist. So this emphasis and individualistic or individualized training, I think we need to keep in mind in psychiatry training in particular. We also, of course, have to teach research methods and how they can be skilled to generate research projects. Today, many practitioners may not think that research is important, But I believe some elements of research are useful, not just to apply it to doing research by oneself, but also reading various articles which are now flooding the information sector, how to understand those articles, how to analyze them. The research methods become very important. Not sure how many of us as teachers are focusing on this skill being built in the students. Postgraduates also become teachers. How do we build the skills of teaching in them? It may start from how do they make a seminar, how do they make a journal club. The contents part of it is one aspect, of course, that's very important that we look up and teach them. But more importantly is how can they make an impact of their presentation, which in turn will translate into the skills of teaching later on when they become teachers. Unfortunately today, in the curriculum of PG training, there is no specific element of how to build skills of teaching in postgraduates who would eventually want to become teachers. So this is an area which has not been, may not have received so much attention than what it deserves. Today, thanks to COVID, digital technology has come as a flood into this webinar is an example of that. And learning psychiatry, learning any medical specialty, I remember using the webinar program, using the National and Immense Digital Academy during the early days of COVID. Many universities used them to train their health workers on many areas of COVID management. I'm sure this using digital technology and mass educating of healthcare workers probably has made an impact in reducing the mortality in our country and possibly also reducing the prevalence of COVID infection. So the digital technology has become a very, very important medium. And this is something that we have to exploit for making teaching to a wider spectrum of people. Thankfully, so demonstration of physical science to be with the patient is not something so important, although it is important. I'm not belittling it, but demonstration of skills of eliciting clinical science, which requires mainly the audio and video input, not necessarily a three-dimensional. Being there, you elicit the reflex, you look at the plantars. Those will have to be there physically with the patient. But whereas learning clinical skills, understanding psychopathology, and looking at the management program, digital technology is to be exploited more in psychiatry than in other fields of specialty. Teaching need not be a one-way affair. I teach, you learn. But I think they should also prepare themselves to learn by way of generating questions which they need to pose. So the teacher's skill is measurable in the numbers of questions that their students bring in the next day. So the more questions they bring in, that means I, as a teacher, have been successful in eliciting, in imparting those skills that the students look for areas that they need to learn. More often than not, this was taught and I will learn and I keep quiet. But I think the student has to generate an endogenous learning desire, which only the teacher can make it possible. So this is another area where we have scope to build in. Lastly, many psychiatric teachers work with non-medical teachers as well. Psychologists and social workers, sometimes speech pathologists, a few other people who may not be our occupational therapists, or people who are in rehabilitation psychiatry. And today, of course, many of them are also using medical specialties, not from a primary modern medical wing as well. Yoga has been there in many universities, many hospitals, many medical colleges, including AIMS and NIMHANS. So you have teachers in many departments who may not be doctors. So it is important to demonstrate that any teacher is equal. And every teacher is equal, and that sentiment we can build only if we demonstrate that level of equanimity with all teachers, to all teachers. And this will help the individual PG or AUG to acquire skills of a wider spectrum of clinical practice, which otherwise he or she may miss if the teacher has been only from a medical school. So to help students regard all teachers and all from other departments as equal is something that we as teachers can impart. So I have actually flagged those 14 issues which I thought were very relevant to psychiatry teaching in our UG or PG levels of education that we are imparting. So I'll stop here. I hope I have utilized the time appropriately for beginning this session. I must place on record my thanks to other seniors who have been there in this group. Dr. Dalal, Indian Psychiatric Society, the President, O.P. Singh, and many other colleagues who have been here. I thank them all. I thank the organizers for letting me come in and share these few thoughts. So with this, I'll stop. Thanks once again. Namaste.
I would like to thank Professor BNG for his scholarly overview about teaching and how to improve the teaching in psychiatry. He has talked about how to improve resilience in the students and how to individualize and tailor-make the teaching for the students. It has been increasingly common to see a lot of anxiety in some of the psychiatry postgraduates. We have more number of ladies nowadays. We are seeing different kinds of personalities, different levels of enthusiasm to learn, etc., etc. And I think the teacher also has to remember that he should consciously try to improve and should not be afraid of getting feedback from the students also. Most of the postgraduates just enter psychiatry, but they don't know where they want to stay in, whether they want to be in practice, teaching, or research. So it is a process of discovery where they find out who they are themselves and then decide where they need to stay in psychiatry. I request Dr. Rao to give his comments.
Thank you very much, Dr. BNG, sir. Of course, in those few minutes, we have just brought to focus quality, skills, leadership, interpersonal issues, and maybe from the beginning, how a teacher can nurture and help them actually hone all the skills. That way they can not only treating a patient, how actually they can work out to be human beings. In fact, this particular message has been conveyed. We are really grateful to you, and you are the right person to do that particular job. And with aplomb, you have done that particular job. Thank you very, very much. Personally, and I joined Dr. Rajesh Raman in congratulating you and thanking the organizers for wonderful opportunity that they have provided. Thank you very much.
Thank you, sir. I convey my humble regards to the speaker, Dr. B.N. Gangadhar, to the chairperson, Professor T.S.S. Rao, and co-chair, Dr. Rajesh Raman. And I now request our beloved principal, Dr. H. Gowdappa, to do his presentation on opportunities and challenges for teachers in medical colleges. Sir, over to you.
Thank you, Kishor. It was wonderful to listen to Dr. B.N. Gangadhar, who spoke so well about how different it is as a teacher in psychiatry, especially with a special reference to undergraduates and postgraduate teaching, and what are the fallacies, what are the challenges. All those are worthwhile, worth noting. And I'm very thankful to the organizers for giving this opportunity to make me listen to our Professor B.N. Gangadhar. Incidentally, he has been our great advisor, mentor. He is in the board of our management, the highest body in the university. We are very thankful to him for his guidance. Next 5-6 minutes, I'll just take this opportunity to address the title given to me, the challenges and opportunities for the teachers in general, because you will be Are my slides visible?
Yes.
Yeah, challenges and opportunity for teachers and medical education beyond COVID. That is my talk, not specifically to teachers in psychiatry, which you can extrapolate and apply as well. That is little different than the general teacher in a medical college. Basically, a responsibility of a teacher in medical college is he should be punctual and available in the department for all kind of academic transactions, follow the policies and regulations of the university and the institution, and he should conduct classes and practicals on time, plan and prepare for the topics very adequately with the contemporary issues being included, develop and use different teaching aid. As the time advances, we have to incorporate technology. Suddenly, when the COVID pandemic came in, we had to send all the students home, and for the last 9-10 months, we were asked to get adopted to a different technology, online delivery of academics. That was wonderfully done, and that is what is an opportunity that is created by pandemic. Monitor the discipline of the students and take their attendance, induce curiosity, creativity, and lateral thinking among the students than just coming and blabbering the notes that is prepared. That is a responsibility of a teacher in a medical institution, and it is more or less applicable to a teacher in psychiatry as well. Coming to a teacher in a medical college has these many important components. He should be a resource person for knowledge delivery to various kind of requirements at webinars like this, or the international deliveries and conferences and academic programs the institution organizes. Because of the special knowledge that you have got in a specialty of psychiatry, you are a resource person, and I see Dr. Rao, Rajesh, Raman, Kishor having been involved and invited by several forums, and they do perform as a teacher to the mass and teacher to the students in general in the institution. He should be a curriculum specialist, instruction specialist, a role model, a very, very important. The students learn looking at you than listening to you. So you must be a role model in all aspects. In the passion of teaching, in the passion of treatment, they observe you, what you do. And eternal learner, teacher in any specialty, every day we keep learning. And the greatest opportunity given for this profession is a teacher has always a provision for learning and relearning to teach, only to teach. So teaching is the only profession which creates an excellent ability and opportunity to learn more and more, accumulate more and more, transfer more and more. You should be the teacher is a communicator, and teacher lastly is a researcher. As Gangadhar was telling, in those days when we were UG students and PG students, research was hardly given an emphasis or importance. We were just made to adequately learn to the skill of eliciting clinical science, making some diagnosis through the clinical science, and to some extent by investigation medicine. Now the things are reversed. Investigation medicine has taken an upper hand, clinical skill has become suppressed, the teachers are also modified in that extent. That is a challenge for these teachers. We learned from our extremely clinical skilled teachers. Now our students are learning through half-skilled teachers. They believe on the web information, they believe on the investigation information, they make a diagnosis and then examine the patient. Research was never a challenge, the priority earlier. It became a priority, now it has become a challenging issue because a clinician, in the midst of using his time for teaching, whether it is psychiatry or general medicine and so on, they need to be a researcher. Otherwise, you don't flourish in the university, in the academia. Having said that, these are the various points on which a teacher acts as a facilitator, the information provider, and resource developer, planner, and assessor. And these are all the various components of each one of these responsibilities. What are the challenges for teacher before COVID and after COVID? Before COVID also there were challenges which we were trying to overcome. Once the COVID came in, there was a sudden fear among the teachers and clinicians of entering the hospital, trying to talk to the patient, trying to take care of the patients, and trying to talk to the students because of coronaphobia. Then there is a technophobia. Suddenly we were asked to deliver, especially UG teaching. It may not be so much affecting the psychiatry teaching because PGs were always there. They never went away from the hospital. Whereas UGs were away from the institution for 9 to 10 months. There is a need of teacher to learn digital technology knowledge to deliver it properly, appropriately, develop it to the extent it is acceptable. Competency of teachers for the new norm was a challenge. IT infrastructure in the institution. Just now I had a disruption. I was to be disconnected because the internet was unstable. Hospital setting and clinical care, clinicians are to take care of the patient, to take care of themselves, and they are afraid. Finances and then teaching and assessment were the problem. Time, connectivity, body language is a big issue as a teacher in the COVID pandemic challenge. We all know, we took a feedback when we did 9 months of online teaching. We took a feedback was excellent. The attendance was excellent. 95 to 98% attendance, which was now never there in the physical classes. But what is the outcome of attentiveness? How attentive they are when they are logged in? We don't know because we don't see the body language. That is a big challenge for a teacher. You don't know how they are receiving it, but you are doing it. Students' concentration capability, we all know. Once they cross 45 minutes of your presentation, the next class they may not be ready to listen to you. Internet disruption, lack of assessment for the response because of the lack of not able to see them fully, and practical and clinical training. Though Gangadhar mentioned, we have to take the advantage of digital technology, but nothing like physical science demonstration for skill accumulation for the especially UGs, maybe to the extent for PGs. Assessment challenges are all there. I don't want to delve into it. We have challenges which need to be overcome. But what are the opportunities for teachers in general? This COVID pandemic gave plenty of opportunity. People who did not know how to use their computer, how to make their presentation, how to deliver it to the students, acceptability to the conference, acceptability to the academic delivery, acceptability, they became masters. Okay? Though we were using it, but now we have become little masters. The opportunity given by pandemic was to the teacher was becoming more techno-savvy. Time availability made the teachers to innovate in teaching, and they had plenty of time in their disposal for review the curriculum. They get connected, mentoring, and adopting capacity to the new norm, and digital assessment, and more academic coverage in an available time. To tell you frankly, all the teachers who were assigned to take online classes for all the terms, they did their job, and then before the students came back to the campus, their theory component, all the curriculum, entire curriculum was covered much in advance than the time that was allotted for the regular learning. So that is the advantage, that is the opportunity that was created for the students and teachers. Friends, this was the good feedback on online teaching. Students gave excellent to good. Teachers also were very happy. Parents also were very happy. But I am not very sure about how attentive the students were in listening. These were all the teachers of my college who got involved in digital delivery of knowledge. And I place before you the plenty of classes that were done. And I thank Kishor and the whole organizing team for calling me to address on the challenges and opportunity for teachers in general in medical college in this COVID era as well as pre-COVID era. Thank you all, and it was wonderful to listen to Dr. Gangadhar. I pass it back to Kishor to take it forward for the next presentation by Professor Mohan Isaac. Thank you all.
Thank you so much, sir. It was very illuminating that you took at the full spectrum of the role of teachers as you moved to the challenges and opportunities it was very interesting to see that there were 7 characters at each of the component you said. It's a full spectrum, like a rainbow. A teacher might have to have so many qualities, and COVID has added a lot more expectation, lot more challenges. It's a very illuminating presentation, sir. Thank you so much for this talk on behalf of the organizing committee. Now, I request Professor Mohan Isaac, who is the Professor of Clinical Psychiatry at University of Australia, also adjunct faculty at the Department of Psychiatry, JSS Medical College and JSS Academy of Higher Education, also visiting professor at NIMHANS and Manipal. Sir, over to you.
Thank you very much, Kishor. Distinguished Principal and Dean of the Faculty of Medicine at JSS Medical College, Dr. B.N. Gangadhar, former Director of NIMHANS and my former colleague, and all distinguished colleagues of mine who have been involved in this award ceremony, as well as all the participants. Today is a very important day as far as I am concerned personally, because today is the fruition and the ultimate announcement of something which a core group of people, many of whom are on the screen here, and you will see some of them little later, have been working on. You know, the work has been to find some novel ways of rewarding teachers in psychiatry. I'll tell you a little bit about how this came about and why this, etc., etc. So this morning, as I was reflecting on this afternoon's function, I was feeling very delighted and happy. And incidentally, I also noted that today is a very special day. Why is it a special day? Today, many of you may not have noticed, or some of you may have noticed. Today is the 21st day of the 21st year of the 21st century. Today is, of course, an important day. Now, tomorrow it will not be like today. 21st day of the 21st month, 21st year of the 21st century. Okay, so what I'm supposed to do and what I plan to do in about 7 to 8 minutes are 2 things. One is what Kishor has asked me to talk, innovative ways to reward teacher, but need to reward teachers. And then secondly, I'll tell you a little bit about the scholarship and the IToP award story. Now, do we need to reward teachers at all? Teachers are highly motivated people. We just heard the distinguished dean talk about how teachers have adapted. Initially, they were scared of technology, but COVID has been in a blessing for a lot of our teachers. They have become more computer savvy, more techno savvy, etc., etc. So why should you reward teachers at all? But I believe that not only teachers, in every profession, there's need for incentives, rewards, recognition, etc. Because it's only with that kind of an additional incentive reward that people perform at their peak. Of course, some people perform even without any rewards, but ordinary human beings, such as all of us are, we need now and then some kind of recognition, rewards, etc. Then, of course, the question comes, what kind of rewards? Do you give monetary rewards? Of course, that is a kind of a reward. You know that the Nobel Prize being one of the topmost rewards which people who excel in various fields, including literature, medicine, etc., etc., also get a big chunk of money. So monetary rewards, of course, do matter. Money ultimately makes a difference. But then if you don't have a lot of money, then what do you do? Yeah, are there non-monetary rewards? Of course, when people do various things, including teaching in a medical school, teaching psychiatry, etc., there are various kinds of rewards. One is, of course, the self-fulfillment, which all of us get as teachers. Well, most of the people on this panel, as well as many people who are listening to this webinar, are teachers in medical colleges. So I'm sure most of you will agree. Why are you continuing as a teacher, taking a lot of time? Now, we heard just now from the dean that many people, he showed a big group of people who have excelled in the work in JSS Medical College. Many of them looking very bright, young people, etc. Because we get a certain fulfillment, and there are very many reward systems within which are not artificially created. We have better interaction with students, and if you're a good teacher, the brighter students will come and interact with you and demand more and more things. We get better recognized amongst our teachers. We get better recognized by the management, by the dean. We might be in line for a promotion ahead of some other people who have not been doing as well as we do, etc., etc. So there are sort of inbuilt reward systems in medical schools, etc. But that may not be good enough. And in a field like psychiatry, where we have dearth of teachers, Dr. Gangadhar alluded to it. Gangadhar alluded to very important 14 points of very specific problems in teaching psychiatry. And also, some of the things that he talked give us a reflection of the current status of psychiatry teaching. He said about a PG who joined NIMANS. He must be a bright person, otherwise he couldn't have joined NIMANS. Within the first few weeks, this chap was, and this is not long ago, not 30 years ago, he said 2-3 years ago, this boy was surprised, boy or girl, I don't know, this PG was surprised to know that in psychiatry, psychiatric patients can be treated with medication. He was probably pleasantly surprised. But that is an indication of what kind of undergraduate teaching he has had in psychiatry. Probably he never went to the psychiatry wards. Maybe he went, but he was, as Dean was saying, he was not attentive. At that time, it was not online, etc. So psychiatry teaching, of course, and we also have a dearth of teachers. So there is a tremendous need to innovate, and besides all the inbuilt rewarding systems which are there, we have to create new kinds of award and reward system. What are the other kinds of non-monetary or minimal monetary kind of rewards that we can create? Maybe offering people additional educational opportunities. Maybe giving them a kind of a fast track channel for academic promotions. Maybe some special recognition during certain events. Like maybe we all in India, we celebrate the Teachers' Day, which is the birthday of our former President Sarvepalli Radhakrishnan. Different countries, most countries have Teachers' Day, but it's not necessarily September 5th. It's a different day. So it can be special recognition on such a day, having an event, etc. on that day. Maybe the dean can send an appreciation letter. I thought what Dr. Basavana said showed the picture. If any of them watched, or even if they heard that their dean projected their photographs at the end of his lecture, saying that these are my outstanding teachers, that might be a reward. It's a kind of appreciation. So teaching awards, that's how this particular group of people, which call themselves the Indian Teachers of Psychiatry, under the auspices of the Minds Trust. Also, Kishor, who is teaching in JSS Medical College, and many other people, not only Kishor, Dr. Vinay, Dr. Kiran, Dr. Vikas, many of them are here. They will all briefly appear now to make announcements of this award. That's how this came about. Now, let me tell you a little bit about the IToP awards. The Indian Teachers of Psychiatry itself grew out of several years of deliberations. We knew that Dr. Gangadhar mentioned that there is no teaching skills taught in the curriculum of postgraduates. Not only psychiatry, but any branch of medicine. You are taught how to diagnose, how to treat patients, etc. But you are not taught how to teach medical students. So we realized that in the last 10, 15 years, there have been large number of increase in the number of medical colleges in the country, many of them in the private sector, and many of them had very rudimentary departments of psychiatry. 1 person, 2 person, 3 person departments, or 1 person full-time and 3 persons half-time, and 2 people only on paper because medical council has to recognize, etc. So we thought, and this was also a time when the number of postgraduate seats tremendously increased all over the country. So while there was an increase in the quantity of postgraduate positions in psychiatry, the quality was declining. And one of the areas, because there were not enough teachers, many of the young, newly passed MD psychiatrists got positions, faculty positions in medical colleges as assistant professor, lecturer, etc. But they didn't know how to teach. Many of them communicated that this is a problem. And then, of course, there have been a series of deliberations in the annual conference of Indian Psychiatric Society. And that is how the Indian teachers of psychiatry came up, a group of very, very passionate teachers who wanted to do. And based on the recommendations and surveys that they have done on teachers, seminars they have conducted. I remember one seminar which was conducted in the St. John's Medical College. I'm mentioning this because I find the name of Dr. Manohari, who was a former head of the Department of Psychiatry at St. John's Medical College. When Dr. M.V. Ashok was the head, there was a one-day workshop for teachers of psychiatry. Anyway, out of all these, the IToP evolved, and people felt that there is a need to recognize good teachers and institute various kinds of awards. I've already justified why awards are required in spite of there being, standard rewarding system. We need to have special awards. And then the Minds Trust, using the IToP, was able to win a grant from the Infosys Foundation. Infosys, of course, is known to everybody. But in the past few years, they have also been in a way supporting new innovative programs in the field of mental health. So this is a background to the IToP award story. We have several awards. And in the next 10, 15, 20 minutes, I would invite various people to just come and talk about the award and announce who the award winner is. Let me also tell you, when the scholarship for enhancing teaching skills, what is called as the IToP steps, when it is talked about, they will tell you a little more about it. It was announced. People in the group wondered whether anybody would apply at all, because the money was not big. It was not like 100,000 rupees or what, it was a small amount. But the group was surprised to know that there were applications from all the leading institutions in the country. St. John's Medical College, CMC Vellore, Postgraduate Institute of Medical Education and Research, King George's Medical College. And then the people involved thought that, oh, since there is a good quality application, we must interview them, because the number of awards are very limited, only 4. And the subsequent story, now I will require many people to come on and talk a little bit, taking only a minute or a minute and a half, tell about the award and tell about the person who has won the award. So the number of awards are the IToP's UG Award, IToP's PG Award, IToP Scholarship for Teachers, which is called the IToP Steps, the IToP Small Grants Project for Advancement of Research in Teaching, and then there is the Dr. C. Shamsundar Award. So may I now firstly request Dr. Vinay to come up and talk about the IToP UG Award, please. Dr. Vinay is a faculty of the Adi Vinay.
I'm just going to tell about a brief background of this award and then announce the winner. So this Indian Teachers of Psychiatry way back in 3 years back by Minds United Trust. And this year we have the boost from the Infosys Foundation by funding it. And this award carries a cash prize of rupees 5,000, a memento and a certificate. So eligibility criteria for this award is, this is for any individual or group of psychiatry teachers from same or different institutions, or even the whole of the psychiatry department, or even joint efforts of many psychiatry departments. This is for any initiative or research that has implication in undergraduate training in India. And this proposal has to be sent to the trust via email and also hard copies before 30th November of every year. And those works or papers or posters which has been presented or published at any psychiatry or medical education conferences or journals will also be considered. A panel of 4 judges, 2 each from government and private, who have minimum of 10 years of experience in undergraduate psychiatry, will choose the best amongst them. So the decision of the panel will be final, and the award will be presented at a suitable forum like this by the trust before 30th March annually. So with this background, I'm going to announce the recipient of this Minds United Trust Indian Teachers of Psychiatry Award undergraduate section for 2020 and 21. It goes to the Department of Psychiatry, St. John's Medical College, Bengaluru, Karnataka, for their consistent work on how to teach psychiatry to medical students. Being a MCA recognized nodal center, they are doing a commendable job, and hearty congratulations to all the faculty of St. John's Medical College. And we have with us Dr. S.M. Manohari, madam. We would be happy to hear from you, madam.
Very good afternoon to all. On behalf of my department and myself, I would like to thank the organizers for their appreciation of the work that we do in our department. Our UG teaching program at the St. John's Medical College Hospital has been built over several decades, and the vision and efforts of my illustrious seniors and predecessors is the foundation on which the current model stands. Two things that we have done to make our UG teaching program work. One is with the students. We have altered the syllabus to make it more appropriate, looking at disorders that the MBBS student has to diagnose and manage versus disorders that they should be able to identify and refer. And we not just teach them the skills of pharmacology and pharmacotherapeutics, but we also teach them some psychotherapeutic skills and see that they acquire those skills. It might be just communication in a better manner to patients, or discussing end of life difficulties, any of those, or breaking bad news. All of those skills are taught to the medical student. We also were the first department to insist on 2 weeks of internship much before the MCI recommended it. So other things that we are doing is that we ensure that the undergraduate student, while they are posted for their clinical posting in psychiatry, follow or shadow the PG student after hours till about 8 o'clock in the evening. We expect the medical student to shadow a postgraduate student to learn how emergencies are dealt with. And so we keep innovating, keep adding adding techniques to our armamentarium to help the student learn better. For example, during this pandemic, we did not stop any clinical classes. Even though it was online, we managed to have student or actor patients and continue to take the classes. Sometimes we even had actual patients that were interviewed by the patient by the student from their own homes. And over here, the teacher as well as the patient were available to, the teacher was available to facilitate the interaction. So we did not stop classes during the pandemic. Another aspect that we have focused on was to make our faculty become good teachers, mainly by making them interested and motivated to teach, as well as monitoring and molding our new teachers. Now, the challenge that we have is to ensure that we have adequate and appropriate assessment of the skills learned. With batches becoming larger and larger and the faculty strength remaining the same, it is a big challenge to ensure that we appropriately assess the students. And we do it in a manner that is time sensitive, as well as picks up and encourages all students to become interested in psychiatry and learn at least the most essential skills. I'd like to again thank the organizers for choosing our department, and this gives us a big impetus to continue to work in this area. Thank you.
Thank you very much, Dr. Manohari. Hearty congratulations to you as well as to your department. And thank you, Vinay, for announcing. May I now request Dr. Kiran Kumar of Vaidehi Medical College to announce the postgraduate award, the IToP's Minds IToP Award for postgraduate section. Dr. Kiran Kumar, please.
Yeah, thank you very much, sir. Indeed, it's my pleasure and privilege as a founding member of Minds United Trust, along with the Infosys Foundation now, to announce this very important award. As Professor Mohan Isaac sir was telling, there is increase in the number of postgraduate medical students in psychiatry every year. The number of colleges are increasing, and it has become quite pertinent to reward these teachers of postgraduate studies. As Dr. Vinay said, the same criteria that we have been using for UG section is also been applied for PG section. And this award consists of a cash prize of rupees 5,000 with a memento and a certificate. And again, as UG, there are 4 panel of judges, 2 each from government and private, who have a minimum of 10 years of experience in psychiatry, particularly postgraduate psychiatry, who will choose the best. The decision of the panel will be final, and the award will be presented on such occasions as today, before 30th March of every year. And for this year, it's my privilege to announce the postgraduate award. And for the year 2021, it goes to the Department of Psychiatry, D.Y. Patil Medical College, Navi Mumbai, for initiating online program for psychiatric postgraduates, which is free for all PGs since 2015. They also have a resource which has been recorded, pre-recorded, and it is available for all of us to view, which is a commendable effort. I congratulate each and every person involved in making this a success in the Department of Psychiatry, D.Y. Patil Medical College. I would request somebody to represent D.Y. Patil Medical College if they're available online to say a few words about the initiative. Thank you.
Thank you. Thank you so much again. I hope you're able to hear me.
Yes.
I'm honored and humbled to receive this award on behalf of Department of Psychiatry, D.Y. Patil Medical College and Hospitals, Navi Mumbai. The credit of this activity on behalf of the department goes to Dr. Rashmin Cholera, who is a professor with us. It was solely his planning and execution that made this activity, this educational activity possible. He has been conducting this activity since the COVID. I would request if Dr. Rashmin is around basically to speak a few words about whatever activity that he has been conducting basically for the last 4 years. Thank you so much again. And I'm really humbled about this award that being presented to D.Y. Patil Medical College and Hospitals. Dr. Rashmin, are you around?
I am not sure whether around. Is he around? Okay. Since we have constraints of time, we'll go ahead. Congratulating to Rashmin, Dr. Head of the department, and all the faculty of D.Y. Patil Medical College, Navi Mumbai. Please keep it up. Thank you, Kiran, for announcing this award. Now we'll move on to the next award. This is called the IToP STEPS. STEPS stands for Scholarship for Teachers Towards Enrichment in Psychiatry Teaching Skills. And to announce this, may I invite Dr. Arun Mohan of JSS Medical College, who has been very actively involved in the STEP scholarship program and the selection. Dr. Arun, please. Sure, is Arun around to announce? Hello. Okay. Kishor, is Arun around? Do you know?
I think, sir, if he's not there, I will do that.
Okay. Why don't you go ahead and talk about the IToP STEPS Award and announce the result? Please go ahead.
So the IToP STEPS is a unique program initiated with the funding from the Infosys Foundation, which looked at whether we can provide online training of teaching methodologies to the psychiatry teachers across India. The criteria where they should be part of the medical college, they should apply for this award. The application also looks at what they have been learning and what they are interested in. There are 4 scholarships in this program. 2 are mandatorily for the government institution, 2 are mandatorily for the private medical college, so that there is justice for the 2 kind of institution in this India. And this program will look at how do we train for 20 hours in an online platform of this teacher through peer-to-peer methodology using some of the best and the most recognized teachers in psychiatry who also have background in medical education. It will also have external members outside the Department of Psychiatry. So it will have a cash prize of 10,000 at the successful completion of this scholarship. And for this year, the number of recipients for this program are Dr. Dhirendra Kumar Mishra, Sham Shah Medical College, Rewa, Madhya Pradesh. Dr. Sujit Kumarkar, King George Medical College, Lucknow, Uttar Pradesh. Dr. Gopal Das, Basaveshwara Medical College, Chitradurga, Karnataka. And Dr. Shubhangi Dire, MGM Medical College, Navi Mumbai, Maharashtra. Congratulations to all. I request Dr. Dhirendra Kumar Mishra to talk for a few seconds on his interest and his application. Over to you, Dr. Dhirendra Kumar Mishra.
Thank you, sir. I am feeling happy and honored to receive this award, and I am more excited toward the upcoming classes in this class, and I give my best to fulfill the objectives of this organization to deliver quality teaching services to medical undergraduate students and PG students. Thank you, sir.
Thank you, Dhirendra. Hearty congratulations to Dhirendra as well as Sujit Kumar, Gopal Das and Shubhangi Dere. It was a very highly contested 4 positions of scholarship. Hearty congratulations. Thank you very much, Kishor, for announcing this award. Now we move on to another award. I mentioned earlier that there were very, very good applicants. In fact, literally all the applicants could have been given the scholarship, but unfortunately there were only 4 scholarships. But the Minds Trust, through the kind courtesy of Infosys, had the possibility of awarding, some more people who attended in the interview. There were very, very well-accomplished teachers who applied for more learning. And I think the Dean earlier mentioned one of the things, I think Dr. B.N. Gangadhar mentioned one of the qualities of a teacher is wanting to learn more and more. They are lifelong learners besides teachers. So to talk about this grant, a small research grant for further research in the field of teaching of psychiatry, to talk about it and to announce the winners of this research grant, may I request 2 persons who are actively involved in the interviewing and the selection process. Dr. Hinal Shah, who has been introduced and welcomed initially during the welcome speech by Kishor. And secondly, Dr. Vikas Menon, who is from Dept, who was also introduced. So may I request Hinal to come and speak few words, and maybe Vikas and one of you can announce the names of people who have won the research grant. Hinal.
Yeah, thank you. So, we kept talking about education and improving education, but we also realized that there are many people who have niche areas where they can work on. And secondly, whatever education plans that IPS, IToPs, and all of us teachers are doing, they need a base to which to see whether what we are doing is right for our context. And most of educational research is Western based. Therefore, I think this is a wonderful step, and really Minds United Trust has gone ahead and decided to give some award for research in medical education. And this research will be completed over this year with the help of some of the members who are part of the IToP team. And we are hoping that this will give information and valuable steps to improve overall education. So the winners for this, I will ask Vikas to announce them, please.
Vikas, please do say something about this and then announce the winners.
So this much has been said. Thank you, sir. Much has been said about the need for teachers to upskill themselves, and perhaps psychiatry teachers, it's perhaps more relevant because they start off with an obvious disadvantage. The students are not as switched on in a psychiatry class as they are, say, for a medicine or surgery class. The reasons for it we all know. There's no need to elaborate. So it was against this background that the group, the leadership group, thought of conceptualizing a program that can equip teachers with the necessary skills. And it's a very unique, first of its kind program in India, and I dare say the world, that such a platform is being offered for teachers to upskill themselves and try and stay one step ahead of the learners. Very early days in the life cycle of this program, but given the credibility, wisdom, and experience of the leadership group, as well as the tremendous enthusiasm that this program has generated, as Mohan Isaac sir was referring to, we were really overwhelmed by the number of applications that were received from all parts of the country. I think this program and this journey is going to be very exciting. And as sir said, the research grants, that is all going to be a critical piece of information to provide very India-specific data on how we can fine-tune our teaching techniques further. So with these few words, I'll now be happy to announce the winners for this research grants. So there are 9 winners for the Enrich Research Grant for Psychiatry Teachers 2020-2021. Dr. Colonel Rajiv Kumar Saini from the Command Hospital, Kolkata. Dr. K. Raman from Savita Medical College, Chennai. Dr. Johnson Pradeep from St. John's Medical College, Bangalore. Dr. Vasant Mekhanamurthy from Krishna Institute of Medical Sciences, Karad. Dr. Suvarna Jyoti from Sri Ramchandra Institute of Higher Education and Research, Chennai. Dr. Asim Mehra from Postgraduate Institute of Medical Education and Research, Chandigarh. Dr. Ravi Teja Innamuri from Christian Medical College, Vellore. Dr. Sujoy Ray from IQ City Medical College, Durgapur, West Bengal. And Dr. Nimmi Chandran from Government Medical College, Palakkad, Kerala. So I think congratulations, first of all, to all the award winners for their, their wonderful performance in the application and the interviews, which has helped them to secure this research grant. And I would now invite Dr. Vasant Mekhanamurthy from this group, representing this group, to share her perspectives on this award.
Good afternoon, almost good evening to everyone here. I'm really grateful to Minds United, IToPs, and Infosys Foundation on behalf of all of us winners of this research grant. I'm sure this is an important incentive, an external incentive, but very essential, and it will motivate all of us to do better in terms of our teaching skills. One of the important areas of interest for me is UG teaching, which all the stalwarts here have alluded to. And that's one of the areas that I hope all of us can provide some rich material of information and data to enhance teaching in psychiatry and undergraduate. Thank you very much for giving us this opportunity, sir. Thank you.
Thank you, Vasanta Meghna. Hearty congratulations to you as well as all in the group. Thank you, Vikas and Hinal, for talking about this particular Enrich grant as well as for announcing the winners. Now we'll move on to the next award. This is the second last. This is an award named after a very distinguished former colleague of mine, Dr. C. Shamsundar. This is called the C. Shamsundar Award. And to talk about the award and to announce the winner, may I now invite Dr. Lakshmi Pandit, Professor of Psychiatry at the KIMS Medical College. Dr. Lakshmi Pandit. Is Lakshmi around? Can you please come up and talk about the award and announce the winner of the award? I don't find the name of Lakshmi in the list. Of course, I don't know. There are some where the phone's numbers are written and not the name of the person. So could Vinay or...
I'll do it, sir.
Okay, Kishor. Please.
Yeah.
Briefly about the award and the winner.
It's important for us to recognize Dr. C. Shamsundar, who has been a person with some of the best qualities we can think of. He has been consistently looking at how do we encourage people to look at human values and well-being. And this award was initiated 3 years ago by Professor Dr. Lakshmi Pandit and other people to say that there has to be some kind of research to look at how we can enhance human values. And this is open for anybody in the state of Karnataka who is in a teaching institution, not necessarily a medical college. The research has to be either narrative of personal experience or qualitative studies, and the single best paper will be awarded cash prize of 5,000, certificate and memento. There are a group of panel people who will keenly look at whether the award is deserving in the area of interest, and ultimately at the completion of the evaluation the awards are announced usually, and it will be handed over when the opportunities are there. So for this year, the award goes to Dr. Chandu Korla from Department of Anesthesia and Critical Care, JSS Medical College, Mysore, for the research work, Human Values and Mental Well-Being in Anesthesiologists during COVID-19, which was carried out by Chandu Korla, Shanu Desan and Anil Kumar. I think Dr. Chandu is here. Over to you.
Yes.
Yeah.
Yes, sir. Sir, good afternoon, sir. Sir, am I audible, sir?
Yes.
So, good afternoon, everyone. My study was about human values and mental well-being in anesthesiologists during COVID-19 pandemic. Though it was restricted to the Department of Anesthesia alone, the process helped me understand that healthcare professionals' mental well-being was significantly affected, but there was no compromise in the quality of patient healthcare. And this could be possible and attributed to the moral values they uphold as an integral part of our profession. And I would like to take this opportunity to thank Dr. Anil Kumar Sir, Associate Professor, Department of Anesthesia, who helped me to conduct this survey, as well as a special mention to Mr. Shanu, Department of Psychology, who helped me, clinical psychology, who helped me with the literature work, and all my friends and colleagues who actively participated in the survey. Thank you so much, sir.
Thank you. Thank you very much, Dr. Chandu. Hearty congratulations to you and your co-investigators. And thank you,
so much.
Kishor, for announcing this. Now, the last award in this list of awards is the Srimati Vimala Kulkarni Award. And the person named to talk about the award and announce the winner is Professor Prabhat Chandra of Nimans. I see the Nimans and Prabhat Chandra logged in, but I don't know whether she's around, because I saw in the chat box a message saying that there are 80 more patients in the outpatients and she is still in the outpatient. Prabha, are you around? Are you free to make the announcement? Probably Prabha is not around. Kishor, may I come back to you for this again to talk about the award and to announce the winner?
So this is the Vimala Kulkarni Award for any postgraduates in OBG in the state of Karnataka for doing any research related to women mental health, and it has to be carried out in the state of Karnataka. The award requires that the applicant should apply for this award before 30th of November every year, and there are 4 judges, 2 from government and 2 from the private institutions. But however, there should be 2 psychiatry and 2 OBG consultants who will keenly evaluate the paper. There's a cash prize of 3,000 rupees in this award and memento. And this, interestingly, this award comes from a book. Royal of all the sale of this book goes to this award, and for this year the award goes to Dr. Jeffy Constant from Department of OBG at Bangalore Medical College, Bangalore, for the research work Postpartum Post-Traumatic Stress Disorder Symptoms in Indian Women, Frequency and Risk Factors, which was carried out by Jeffy along with the guide Srinivas and Prashant. Jeffy, are you around?
Yes, sir, I'm here. Good afternoon, everyone. I'd first of all like to thank this organization for this award. This opportunity actually gave me the chance to work with 2 of my favorite professors from UG. I have done UG and PG from BMCRI, and having felt that OBG and psychiatry were my favorite subjects as a UG, this was like a coming together of both the subjects and an opportunity to work with Dr. Srinivas and Dr. Prashant Enrich. both of whom were very inspiring professors. With regard to my topic, I had chosen postpartum post-traumatic stress disorder in women because one of the persons, my sister in fact, she had had some of these symptoms during her postpartum period. And when I looked into the review of literature, I found that Indian studies on this topic were very rare. So all in all, it was a very fulfilling experience, and I'm really grateful for this opportunity. Thank you, everyone.
Thank you, Jeffy, and thank you, Kishor. Now, before I hand over to the moderator, let me once again congratulate all the award winners, and let me also thank all the people who are involved with this award to come and make the announcement and talk about the award. I think this is, I began by talking about, is there a need for reward, recognition, appreciation, etc. I think, and I affirmatively said there is a need that will bring in better and better performance. Not that these people need an award and recognition to do their job, but this is the way in which we recognize their good work. And this is in a small way the Minds Trust and the IToP groups way of recognizing and rewarding and providing an incentive to all these excellent teachers in various medical colleges all over the country. Some of them have been offered additional educational opportunities and skill enhancement opportunities. But above all, I don't know whether this is a big event, but I began by saying I'm delighted that this is a big event. I think this is a big event to convey our appreciation, because this is attended by the Dean of the JSS, one of the topmost universities and medical schools in the country. This is attended by the former director of NIMHANS, Dr. B.N. Gangadhar, who is also now a very senior functionary in charge of medical education at the National Medical Commission. And then not only that, we have three important senior functionaries of the Indian Psychiatric Society: the president, the secretary, and the treasurer, the editor. So this is our way of appreciating excellent teachers in the country to help them to do more and more and better work. Thank you very much, Kishor, and back to you for further moderation.
Thank you so much, sir, for accepting this invitation and playing such an important role in grooming all the programs and initiatives on behalf of the IToPs and My Trust and the Department of Psychiatry at JSS Medical College. We thank you for all the support. More to work with you. Thank you so much, sir. Now I request Professor P.K. Dalal, President of Indian Psychiatric Society, who does not need any kind of introduction, to talk on role of professional organizations in empowering teachers. Sir, over to you.
Thank you, Dr. Kishor. Can you share my slides? Yes.
Yes, sir.
Am I audible?
Yes, sir. You're audible.
Yes.
Okay. So, Professor Mohan Isaac, Professor B.N. Gangadhar, Professor Dean of JSS Medical University, our IPS office bearers, Honorary General Secretary Dr. T.S.S. Rao, and Honorary Editor Dr. O.P. Singh, the organizers, Dr. Kishor and others, and all the other participants. IToP is a wonderful, I would say, beginning. And I mean, IPS is also on that line only. Can I have the first slide? Dr. Kishor?
Yes, sir.
Empowering teachers to empower everyone. The role and function of teachers are challenging. A teacher must continually strive to develop themselves professionally using a variety of ways, both formally and informally. And professional development of teachers is needed, which may embrace a wider scope of purposes. Can I have the next one? Psychiatry's evolution has entailed clinical, educational, research, and other administrative challenges. Top-down efforts by national and international organizations and bottom-up movement by individuals in numerous local settings have helped faculty and guided the profession forward. And alongside the existing framework, professional organizations such as IPS can aid in bringing the training gap as well as continuous professional development of teachers. The next one. IPS since its inception has recognized the close association of mental services and availability of trained mental health specialists. It has tried its best to address the teachers' training in psychiatry, which is so crucial for overall quality of trained specialists. Professional development activities need to be interesting, relevant, feasible, affordable, and also accessible. Teachers are uniquely positioned among the young doctors and are role models as well as gatekeepers when it comes to mental health. Educators have unique opportunity to recognize and support young minds who are struggling with mental health conditions during the stressful days of medical training. Next one. Next one. Next one. Psychiatry, sorry, the previous one, please. Psychiatry teachers in India, the current challenges, paucity in numbers, lack of holistic training, overburdened with many non-teaching responsibilities, hurdles in teaching and training, questionable level of motivation, poor collaboration, and limited resources for teaching and research. As has been enumerated by the previous presenter, that there is a paucity of numbers, we all know, and therefore the IPS is harping on it and trying to convince the MCI as well as the NMC that psychiatry should be made a UG subject, and so that when we get the postgraduates, they are at least they know some of some of the things related to psychiatry at the UG level. And we all know that currently the NMC has come out with a lot of say CBME, that is curriculum based medical education, and SLOs are also, specific learning objectives are also being prepared nowadays, but the skills assessment of skills is lacking. So unless they are being examined and their marks are being added to the UG, it is difficult for the students to motivate them to learn psychiatry. Can I have the next one? Empowering teachers of psychiatry. So there are some facets important are clinical care, publication, training, research, and education. Can I have the next one? So in clinical care, there is hands-on training, and I would say that some of the areas like yoga, CBT, neuromodulation, and all these things, and maybe forensic one, they are all lacking, in fact, in some places of PG training. So it is important that the faculty is being trained in some of the important educational institutes, maybe NIMHANS, PGI, or other maybe JSS, AIMS, and the other institutes which can be identified by our society and identify the, will you please go to the previous one, and identify the faculties over there, and those new faculty members who are actually interested in this, they can have some first-hand information, some hands-on training. And in that, we all know about developing clinical practice guidelines, which has been very painstakingly and laboriously done and being developed. So this can also be of immense help in empowering teachers in psychiatry. The next one. In research, we all know that is IPS multicentric studies are there, and we all know that that you will be glad to know that ethics committee is already formed. IPS ethics committee is formed, and we are in the process of registering it with the government of India, and that process has already begun. And there is Dr. O.P. Singh is here, and the other members are Professor Ajit Avasthi as well as Professor Sandeep Grover. So IPS is going ahead, and as soon as it is registered, there will be multicentric studies will be there, and the people in teaching as well as in non-teaching psychiatrists, they can submit their research proposals, and they can do researches, good quality researches, either in their either at one place, or it could be multi-centered as well. So and in this it has already been advocated that the research grant, the number of research applications as well as the research grants may be increased by IPS. Can I have the next one? Next slide, please. So as I told you that it is ethics committee, formation of ethics committee is already on track. And after the formation of ethics committee, the IPS plans to engage into scientific research and publication with full fervor. The next step will be the creation of accredited fellowship programs, that is maybe some short-term and long-term fellowship programs according to the need of the nation. And going forward, IPS is going to allocate more funds for research activity, and IPS fellow members, teachers, as well as private practitioners can apply for research projects, and IPS can increase grants for the same. Can I have the next one? Coming to education, IPS focuses on psychiatry as an independent UG subject and PG psychiatry department in all medical colleges. So with that, what will happen that our young PGs who are coming out, there will be a vast opportunity for them to join these medical institutes, because what data which I am having is that out of 544 medical colleges, only 234 medical colleges are having PG psychiatry facilities. So when all the medical colleges, what we are harping at that not only psychiatry should be made a UG subject, but also all the departments should have PG facilities. So when this will happen, lot many more positions for psychiatry teaching will be created, and then there will be more opportunities for the teachers. National and zonal midterm CMEs involving young and senior teachers, this activity is already going on. Can I have the next one? IPS publication committee is encouraging teachers to publish in their areas of expertise, and this is also doing a good work. So it is, in a way, it is rewarding them that they are coming out with their areas. And as has been said, that publication, India specific publications or relevance to this part of the world, the publications of book chapters and books are required, are the need of the hour. So IPS is looking in this area also. Can I have the next one? Coming to the training part, IPS provides opportunity for young teachers for travel fellowship. It is at present they are 2 or 3 in numbers, and it is for 2 weeks, but IPS is thinking of increasing the number of weeks as well as increasing the number of this travel fellowship programs, as well as some other short and long term certificate courses is also in the pipeline for the Indian Psychiatric Society to deliver. Can I have the next one? As I was telling you that there are travel fellowship for young member psychiatrists of IPS. They are usually the young teachers. This educational program focuses in strengthening the clinical skills of young psychiatrists in their areas of interest by undergoing training in any institute within the country under the guidance of field experts. these young psychiatrists return to their parent institute and carry forward the baton of knowledge. Similarly, IPS has planned to initiate short and long-term certificate courses for focused training. All these short and long-term certificate courses are in the pipeline. Can I have the next one? Appreciating our teachers. So as has been done by IToP, IPS also believes that teaching should be recognized and rewarded, and IPS strongly supports academic promotion on the basis of excellence in teaching and research, and contribution to teaching is a significant factor for clinical excellence awards of IPS awarded in our annual conference. And this year also we are felicitating two important teachers, that is Dr. Chitranjan Andrade and Dr. Jacob, who have got the Harvard Award for publication, for quality research publication. Can I have the next one? Psychiatrists who teach medical students should have access to training in appropriate methods of teaching and in developing valid and reliable assessments. IPS is a platform to bring psychiatry teachers together to share their experiences and resources that benefit psychiatry training of undergraduate and postgraduates, as has been already been talked about steps. Can I have the next one? So teachers must be always ready to adapt, or create teaching strategies that are in line with technological advances, developments, and innovations in education in general, as well as the ever-evolving real-life needs. And we have seen that the resilience amongst teachers of IPS or different institutes in this COVID period. Professional bodies such as IPS can provide training and resource for teachers and work in sync with existing framework of governmental policies. Additional innovations and evaluation regarding best practices for faculty development initiative in psychiatry are needed. Next one. So the vision of IPS is enhancing the training of teachers and strengthening the teaching skills, innovation in training for teaching, training of teachers as a part of professional development, high quality pedagogic research in psychiatry, and encouraging the medical graduates to opt for psychiatry as well as to take care of burnout of medical students. So thank you for your kind attention and having me here. Thank you.
Thank you so much for the wonderful presentation. It is to be noted that it is under the presidency of Professor P.K. Dalal that for the first time IPS faculty training task force was put up, and this is the initiative which the current the presidency took to ensure that the faculty of psychiatry received training, and it was very well quoted about all the 5 dimensions where the IPS is providing support in training, patient care, research, publication, and other things. Sir, on behalf of the organizing committee and all of us, we are thankful to you for putting forth this, coming to this platform and sharing your experience on the organization's role in empowering teachers, and also for considering to initiate a task force on faculty training. I now request the next and the last speaker, Dr. O.P. Singh, who is a professor of psychiatry at the West Bengal and who is also leading some of the best programs in online for postgraduates. And his journey with the teacher is quite popular, and he has ensured that the educational and research initiatives from the psychiatry teachers are in the journal, who's also the editor of the Indian Journal of Psychiatry, which is a PubMed index journal. Sir, we welcome to you to this program, and we request you to talk on role of teachers in medical education research. Over to you, sir. Thank you.
Thank you, Dr. Kishor. This is pleasure for me to be here, and in fact, it's an honor to share the stage with Dr. Professor Gowda, Professor BNG, Professor Mohan Isaac, Professor Dalal, Professor TSS Rao, and all of you. This is something which is, I have been to the JSS as an MCI inspector and also in different programs many times, and the leadership and innovation in JSS is something which always has impressed me. So I'm very happy to be here. And while coming to the topic, I think my predecessors have already talked about a lot of things. Dr. Professor BNG has said, and then Professor Dalal has outlined what should be done for the medical teachers, and IPS is doing that. So coming to this, I must say that I have not thought of as a research in medical education, and this lead to lot of my thinking that why it is very important. So what we know about the medical education research, it includes evaluation or transfer or acquisition of knowledge, attitudes or skills in any topic relevant to human health among any type of learner, including health professionals, students in the health profession, and patients and caregivers. While we talk about medical education, we generally think of only our students. But since we can understand the COVID, the information about COVID, and now with the hesitancy about vaccines, this is the most important field of research, that how to put your message across, how to put your what you want to say to the people, not only to your students and fellow doctors, because this is going to change lives in millions, not in ones or two, which we see in as a clinical practice. So this is something very important. And areas of research may be patient care, how it is affecting our education, medical knowledge, practice-based learning and improvement, interpersonal and communication skills, system-based practices, and professionalism in our medical undergraduates. Now MCI has changed their curriculum, and we, in fact, the term has been also be changed, the Indian Medical Graduate, IMG, and we want them to impart knowledge at par with any medical graduate all over the world, or better than that. And for that, we need research in our methods, how to go about this. And for this, outcome measures will be how the change is knowledge is there, what is the change in attitude and skills, how it is affecting their behaviors, and ultimately what is the difference of education in patients' outcome. So that is the most important thing, and that is the one of the most major areas of research. So in fact, a paper from JSS only, Professor Kulkarni has said that always people are complaining that our standard of falling. Professor BNG has said that we are has been more focusing on knowledge rather than skills. So our doctors are failing to come out with necessary skills. So as a response to this, competency-based curriculum has come, where skills has been also given important. So to improve our quality, we need to adapt, as Professor Dalal has also said, continuously, which can only happen. We have research and outcome measures. What to change? That for that we need research and measure outcomes. So why it is important? It is very obvious that it equally, if not more important than clinical studies. What happens particularly in government sector, doctors, government first sees medical teachers as a doctors and then as a teachers. First, service delivery is more important for any government rather than teaching. So more emphasis is put on service delivery, and whatever other things they do for clinical studies. But the research, medical education research is also more important, how to improve our knowledge, how to improve impartation of this knowledge. The great teacher have a lot of intuition of how to teach, but we need to move from intuition based knowledge to evidence based knowledge of teaching. And teaching is something like I said, like a nuclear reactor. You have to develop a critical mass and to start a chain reaction of knowledge impartment. So for this critical mass to gather, we need what are two things to be required, and for that medical education research is very important. So basically what is happening till now, I found in this meta-analysis in 2019. They have found that around 2015, around 70 papers, more of them have quantitative research, and mainly have they have done surveys and satisfaction for UG students with teaching. There are fewer impact studies. They're all basically Kirkpatrick level 1 studies, that satisfaction from of the teaching. The level 2 is like the change in attitude and knowledge. Level 3 is how to implement that knowledge in behavior, and ultimately level 4 is how this is going to change the organizational behavior or total policy planning. So most of the studies are now the first level, and lot of studies in government programs are pre-intervention and post-intervention. Like you do a training when you give a pre-intervention questionnaire, and after that post-questionnaire interview. So that only gauges mainly the slight knowledge and satisfaction. Does not come out much. And medical education units in most colleges are like just appendages for as per MCI requirements, and there is very much evident lack of innovations. So COVID has brought impact of educational materials and communication for mental health, what is required. So this has amply pointed out by BNG also, that it must have saved millions of life. So medical teachers has to take the role of researcher in health education. So this is our primary responsibility. For this, we require hypothesis generation and of course evidence generation. And what is that most important is that I have to be aware about what is happening in other fields of education. I must say that they have much better resources than us, because education is a common topic, and all the universities are doing great work and innovation for education research. So we should be aware. I have, like in my editorial, I've said that for clinical research also, we should collaborate with other basic sciences. They have much more advanced biotechnology and applied physics and all those things. So similarly for this also, we should be aware of what is happening in other fields. Management colleges, they are very much good in this kind of things, and other colleges. So we should have an collaboration and knowledge about what other people are doing in this field. So we have to go beyond our comfort level. As in other fields, forming collaborative alliance in field of medical education research is important. And we, as a teacher, we should go for this and encourage this. Research in education should be our priority and also should be responsibility. As I've said, that you can light a series of lamps, a chain reaction, and we should publish and disseminate this educational research. And as the editor, I'm there to support it as much as possible. So, and then changes in the air, because already MCI has come out with competency-based medical education. National education policy is freeing a lot of things from the stereotypy and tradition, which has become a burden. And the government of India's recent initiative to support research, and also their plan to buy all the journals to make freely available to all the people in India. That is a great work, and we should also contribute by doing our bit, by doing research in field of how we can impart medical education, medical knowledge to our doctors and also to the general people. And medical teachers are the people who should be responsible for this. With thanks, I thank to JSS Medical College. They have been leader in innovation in education. IToP, PG Education Committee of IPS Faculty Training Task Force for kindling this flame. I must especially thank Dr. Kishor, Dr. Rajesh, Dr. Henel, for doing this and inviting me. Thank you. Thank you.
Thank you so much, sir, for very researchly work on talking about role of teachers in medical education research. It's very interesting that you have raised many important dimensions where we can venture. You have also brought in the new changes which is happening both at the NMC in relation to competency-based curriculum as well as the national education program, where there will be many modalities joining with the stream of medical education, and also very positive remark about support to the teachers to publish their research. And this, for many things, we are really thankful to you for taking your time and joining this program. Thank you so much, sir. I would now request Dr. Ajay Kumar, who is the Assistant Professor of Psychiatry at All India Institute of Medical Science, Raipur, also convener of the Indian Psychiatry Society Faculty Training Task Force for vote of thanks. Over to you, Ajay.
Thank you, sir. Good evening, everyone. It gives me immense pleasure to deliver the vote of thanks for this event for all the dignitaries. We extend our sincere thanks to Padma Shri Dr. B.N. Gangadhar, who emphasized the role of skill building among the teachers and the importance of liaison and the especially in this pandemic era. Thank you, sir, for your continuous support and encouragement. We would like to thank Dr. S. Basavana Gowdappa, who has delivered his thoughts about the opportunity and the challenges among the teachers, and highlighting the different role of teachers, and becoming more techno-friendly as per the need of the pandemic. Thank you, sir, for your encouragement and your grace presence in the event. A warm thanks to Professor P.K. Dalal, giving a providing the information of skill building about the teaching in the teachers, and also mentioning the efforts of IPS in this direction. Thank you, sir, for your valuable time and your presence in the event. We remain grateful to Professor Mohan Isaac, who spoke about the importance of reward in the teachings for the teachers, and the importance of self-fulfillment, and he has been a source of inspiration for many of us. Thank you, sir, for being with us and for your continuous encouragement. A warm thanks to Professor Om Prakash Singh, and highlighting the importance of research among the teachers and various areas of research. And so thank you, sir, for being with us and your continuous support. I would also, we would convey our thanks to Professor T.S.S. Rao and Dr. Rajesh Raman for chairing this session and being with us, providing us the encouragement and a helping hand for this program. I also take this opportunity to convey our thanks for the other panelist members, Dr. Vinay, Dr. Kiran Kumar, Dr. Arun Mohan, Dr. Hinal Shah, and Dr. Vikas Menon and other panelists also. And thanks to JSS Medical College and Indian Psychiatry Society, IToP, and Mind United Trust. And I would convey my thanks to all, congratulations to all reward recipients, and thanks to all audience. Thank you very much.
Thank you, Dr. Ajay. We will close the program. Thank you for everyone joining this on this evening. We will end the program. Thank you so much.